So once again, welcome everybody to Irish Hospice Foundation Advanced Care Planning webinar series. This is webinar 2 of 4, Help Me Help You, how we can support people supporting others to plan ahead. My name is Valerie Smith. I'm here in your bottom left corner. I'm the Public Engagement Lead with the Irish Hospice Foundation, and I'm supported today by Lucy Andrews, the Hospice Friendly Hospitals Development Officer. Thank you so much, Lucy. So, I also run our Think Ahead program. You may be familiar with this handy dandy image. Think Ahead is Irish Hospice Foundation Advanced Care Planning Program. We'll talk a little bit about that today and what the resources are that we'll be reviewing today from this. Have 4 parts to this webinar series. The first video recording from last week, On Your Mark, Get Set, Plan Ahead, is on, have 4 parts to this webinar series. On the events page now, so if you scan that QR code right there, you will be able to scroll all the way down to the bottom of that page and find that recording. That's also on our YouTube page, and that is also on Vimeo. We have a recording in last week's webinar folder as well, which will be in the chat there in just a minute. So we are right here. This is our Here You Are sign. We're right here. Webinar 2, Help Me Help You. If you haven't signed up for the next 2 webinars, which are at the end of next month, feel free to do so now. Next month, we'll be looking at basic treatment options for medical treatments, but we'll also be covering a bit of the basics of the choices that you can make around enduring power of attorney as well. And then week 4 is really how do we choose who these people should be that are supporting us in the future, and how should they work together? What kind of rights and responsibilities do we want them to have? And what are the limitations of that as well? So please do feel free to enroll for all of these. All these videos and recordings will be made available with transcription as well. For today, we are looking at the idea of a supporter. So who is it? What do we mean by that? We're going to offer tech support for the DSS. We're also going to review quality of life and behavior change models for advanced care planning. I've actually misput that in there. So quality of life and behavior change first, and then tech support before we close out. This webinar is geared toward professionals, and so we are using some professional tools here. But anybody who's here, if you've attended webinar 1 or if you go back and watch that recording, you'll be set with this as well. We'll do an activity today. We'll show you how to log in and verify your ID with the Decision Support Service. And there's a few materials being shared there into the chat. There is the pack from the folder from webinar 1. In webinar 1, you will find the Personal Wishes and Care Plan. And there's also the pack for webinar 2, where you will find worksheets 3 and 4. I made 2 typos on this slide, but I think those are the only 2 typos that I have in the whole entire presentation, so we should be set. So you'll see worksheet 3 is quality of life and worksheet 4 is barriers. You'll also have access to the materials that we shared last week in that webinar 1 folder. We did a lot last week in webinar 1 and on your marks, get set, plan ahead. We're not going over all of that today. The role of last week was to gather those materials and to understand what we are going to cover in this series. We've broken that down into kind of 2 main sections, the Think Ahead Planning Pack and Enduring Power of Attorney. And within each of those are 2 sort of options that people can, that documents that people can make. So there's 4 documents in total that we're looking at. There are more options for people in planning ahead, but these would be kind of the main options that we're looking at using. And these circled here are the legal documentation, the stuff that needs to be signed and witnessed and has a bit more weight to them as well. So we started by reviewing the basics of what you can include in that last week. And we'll be looking more at my personal wishes and care plan today. There was also a tiny bit of homework last week, if you choose to accept it, reviewing those materials. So we reviewed the Think Ahead Planning Pack, the advanced healthcare directives and the personal wishes and care plan. You may have reviewed that checklist. Are you EPA ready? Are you ready to make your enduring power of attorney? What kind of things do you need to have for that? That's from the Decision Support Service and worksheets 1 and 2, getting ready to plan ahead, which we'll review and go over a little bit of why we use those today. So we're on step 2, webinar 2. Today we're starting those conversations and learning the tech. We're going to start off with this idea of supporters. What do we mean when we say supporters? You'll remember when we have an image like this in the top left screen, that means we'll have a term that we're going to be defining, and this will be our image here. When we are talking about supporters, this is the image that you'll see on the screen as well. When we're using the term supporters today, or supporter, we mean a person or people in formal or in informal arrangements. And these people help another person. I couldn't say the word support again, so they're helping another person to think about their decisions or choices, to make a decision, perhaps to communicate that decision, or to act on their decision. Any one of those 4 things. So that would mean if they lack capacity to do some or all of that on their own. Most of the time, we tend to work with informal arrangements. We often have support. We might have somebody support driving us to the train station. If we don't have a car that week, we might ask somebody to make an appointment for us. Any type of thing. We're always using informal supporters. And a lot of people, it might be you here today, are an informal supporter. You're just trying to help a friend or a family member make some documentations. So you're a supporter. You might be in a formal arrangement with them as well. If you are have a legal obligation to look after somebody, that would be a formal arrangement. Or you might be here as a professional in a more of a formal capacity. But we're using all of these terms today to mean supporters. Family, friends, anybody looking to help somebody start their planning ahead process. This can include also things like support groups or community groups, neighbors, friends, colleagues, family members, carers. All of these people can be supporters. And when we are planning ahead, for the most part, we're in an informal arrangement. We haven't put those formal arrangements into place for the future. That's when things might become a little more formal. But for today, any of those terms, any of those roles that you find yourself in, that's a supporter, and that's who we're talking about. So there are different types of support. Like I said, it might be, physical support of getting somebody to the train station or to a GP appointment. But we're going to look at 3 main types of support for planning. So the first is gathering information. That's where we are. We've done that last week in webinar 1. We started finding out what is the information that we need and bring those materials together. Another type of support that people can find themselves in is having those conversations, talking together. Asking somebody and working through what somebody might want for themselves. And another type of support that we'll talk about is the technical support. There's a lot of details in some of this work, and some of it is tech heavy, using computers, using email, and some of it is technical terms and understanding language. So we'll look at these today. And as a reminder, these don't go in a linear order. So it could be that you're talking, and then you're gathering information, and then you're bringing in the tech support, or you could have started with tech support to gather information and then talk with someone. These things don't matter. It isn't a linear process. It isn't in a straight line, but these are just different types of support that we can offer to people. We'll start today with talking together. And for this, we're going to use my personal wishes plan and several of the worksheets. We are starting with talking because there's another key term we'll want to know here, and this is known will and preference. There's been a big change in how we are looking particularly at medical decisions, but all types of decisions as people age. We looked at this last week with capacity. Does a person have capacity to make decisions? And they have lots more capacity than we would have legally respected beforehand. Now, what we're taking into account as well is this idea of known will and preference. Rather than working at what I think is best for you, we work towards what did you tell me? What did you let other people know was what you wanted and preferred? This is your known will and preference. When you let somebody know what you want and prefer. So, will means your values, your personal beliefs, your goals. This is what you intend to do, what you would intend for yourself. And your preference means liking one thing over another thing. So I might have a preference for blue, and then my will would be that I wear blue every day of the week. So these would be kind of your will and preference. And they might not be as legally binding in all cases as your decisions around certain medical decisions or financial decisions. But when we know what a person's will and preference is, we work toward helping them achieve that goal, even if they don't have capacity to do that for themselves. And like I always tell people in the community level, it's great to have this statement, your known will and preference, but we have to know what your will and preference is in order to act on that. So, known will and preference can include things, and we'll go over this a bit later. Known will and preference can include things like who we see, who we like to spend time with, what we do, how we like to pass our days, where we live, and who we live with, what we would consider living well, and things like what we buy, what we spend money on. There's lots more things, of course, that can be included in known will and preference, but these are some of those key things that can help to determine a person's quality of life. Conversations are the key to this. There are legal documents for those, medical or financial decisions that you can make, but especially around will and preference, having a conversation with somebody and understanding what matters the most to an individual are the key to supporting their will and preference. If it is known what somebody wants for themselves, we can advocate for them and we can let other people know how they like to be cared for, looked after, treated, and so on. So last week we gave you 2 worksheets, 3 pages, 2 worksheets to start reviewing. For those of you who like using documents or writing things out to help think about what it is you might want to do for yourself or what it is you're here for. These can also be used with a patient, with a client, and even if they're not writing out the answers themselves, it can be used to kind of track your conversations. So these are very adaptable. Please feel free to use them and adapt them as needed. So for example, on getting ready to plan ahead, this document had a few questions around importance. Is it important for me to plan ahead? If I'm working and supporting another person or another 2 people, and the first person says that it's not important at all for me to plan ahead, they would rate that sort of a 1. Or after your conversation with them, you say, they're not interested in that at all. It's not important to them. They're a 1. You're at a different starting point than if you speak with somebody else who says, it is the most important thing in the world to me. I can't believe I haven't started it. I need to start today. That may be being a 10. And these people are starting in different places. So understanding some of these concepts, if it's important to somebody to do this work, if they feel confident to do it, or if they need a bit of support, and why they might plan ahead, what they wish to feel, and what their own goals are, will help to guide the process. Sometimes people will also see some negative benefit or some negative drawbacks to planning ahead. So we have this pros and cons list. And it might not be that people are really weighing it out as a pro and a con or a benefit and a drawback, but in conversation, you might find out that a drawback to a person could be that they're afraid of starting conflict or in their family or making other people uncomfortable. So they would see that perhaps as a drawback to planning ahead, something that might pause them from going ahead with it. And we know that things like conflict in the family are actually eased in the future by planning ahead, but there could be something in that short term that needs to be addressed. Or it brings up fears around a person's end of life and mortality, or fears around pain and suffering. And these are all important things to address early in the conversations as well. When we can ease those cons, those drawbacks, and those fears, then a person can move forward a little bit easier with planning ahead. So hopefully these sheets can give you just a sense of how you might use this in the future. Or sorry, of how you might guide a conversation with somebody there. Now, for the professionals in the room, you may be very familiar with this stages of change model. For the non-professionals in the room, you might be thinking, oh gosh, what is she giving me? Don't worry too much about it, but it's just something to think about. This is a model called the theoretical model of change. I don't like that word. We'll go with stages of change. And this is often applied for different types of behavior change, such as quitting smoking or taking up a physical activity or eating healthier, these sorts of habits of health promotion. But it's also been applied toward advanced care planning, and they've done some studies to show that this can be applied in that context. So, what this basically says is that we don't go from knowing nothing about a concept and toward that same day making all the changes in the world around that. So if you're here for the very first time and you've never heard of advanced care planning before, you were dragged along by somebody to this webinar, you're probably here in pre-contemplation. Never thought about this before. Most likely, you're not going to go home today and do all the work. You're just going to learn about it. Whereas if you're here today and you have been thinking about it, you're thinking, I'm not committed, I'm gonna do this. It still seems like a lot of work. You're in this stage here of contemplation. A little bit farther down the line, you might think, okay, well, she did give me a lot of information. It doesn't seem maybe as hard as I thought it would, so I'll start to prepare. I would actually imagine that a lot of you who are here are in this preparation phase. You're gathering materials for yourself and you're learning how to do the process. After that, once you've gathered enough, you've made a decision, then you'll go in to taking that action and starting to make those changes. And then, of course, it's finishing the work. And while the term maybe relapse doesn't work exactly correctly here, it might mean, oh, I stopped doing that for a while, something came up, I put that to the side, but I never go back to this phase of pre-contemplation. Now I'm always aware of it. So I might go back to thinking about starting again, or I might go back to action, but I never go back to the very basics. So once you've learned, you can't unlearn it usually. So you go around in this circle. So it's just understanding where you are, or where your client is, or where your friend is. If they've never thought about it before, they're not going to do the paperwork today, but they can start to think about it. So if somebody has said that they're a 0 or a 1, it's not important to me, they won't be going into preparation that day, but you could maybe move them toward thinking about it. The other thing to keep in mind are what helps a person to make these changes. Again, if you're a professional, you probably know this. And if you're in your personal life, you probably are doing this already to influence how other people make decisions in their own lives or how you make decisions as friends or family. Because it isn't just about the knowledge. Giving somebody the knowledge is an important piece, but it only gets them started on the journey. Again, it's understanding, why would this be important to me? Why would this be important to me? Is it to prevent conflict in my family? Is it for my own sense of well-being as I age, for my own peace of mind? Is it so that I get the right treatments that I want? Is it so that I can live where I live for as long as possible? Understanding a person's individual importance of why this matters will help them set their own goals. Confidence is important as well, and I think this is one area that we see a lot of anecdotally, that people don't have enough confidence in the ability to make some of these documents. And that's why we're here, to guide you through the steps, to show you what you can do and where you can get support where needed to do these, to make these decisions and to make these documents. Confidence can easily be supported here. And motivation. So I might know about it, I might know it's important, I might even be able to do it. But if I don't feel that motivation, I won't necessarily start this before doing something else that maybe also feels important. So helping people understand or identify something motivating that will help them get it done. And for me, as I often say, sometimes that motivation is, once I do this, I get to eat a whole cake to myself. So it doesn't have to be the motivation that's directly related to this work. So between these couple of things, for our professionals, might be more familiar. For our non-professionals in the room, something to start thinking about. We'll include these sheets in there for you as well. and just understanding how a person and why a person might choose to start doing this work. So you received last week the Think Ahead Planning Pack. We looked more at the Healthcare Directive, and today we're going to look a little bit here at the Personal Wishes and Care Plan. So we went over this Think Ahead Planning Pack last week, and I'm just going to share about 20 or 30 seconds of that video that we had that was just on the Personal Wishes and Care Plan to remind you of this piece of it.
In my Personal Wishes and Care Plan, you can record your preferences for care. For example, where you would like to be looked after. It includes information about your legal and financial paperwork and your funeral plans. These decisions are important to describe so others know how to look after you and don't have to make those decisions for you.
But others don't have to make these decisions for you. These are not the legal documents. It's not the healthcare directive. Putting your funeral plans down in this document aren't legally binding, but it's informational about your known will and preference, or the person that you're supporting, their known will and preference. The Personal Wishes and Care Plan has lots of options for a person to think about what matters to them. It could be financial, recording financial decisions, could be funeral arrangements, it could be information about care or digital legacy. All sorts of things are included in the Personal Wishes and Care Plan. And this is a great place to start, I think, when we're starting these conversations, starting to talk about what the future might hold, because they're so open and because they're not legally binding. Can really open up to what a person matters, what matters the most to a person. So if a person has said, I absolutely want somebody to know about my finances and where everything is stored, there's a place for that. And they may not have thought about another aspect of it, and they don't have to. They don't have to complete the whole document, but it might prompt some of those questions going forward, things they haven't thought about before. Lots and lots of options for a person to begin with in the Personal Wishes and Care Plan. So these are what some of those pages look like. It'll include questions like place of care, find where a person prefers to be living, financial records. This can be really important for people who know they would have an enduring power of attorney for finances in the future and want to make sure that all those legal or financial accounts are. It also includes information here on making a will and how to do that. So lots and lots of things that a person can think about. We are updating these documents hopefully this year for language and other items that people have suggested to us over the years, making things a little bit clearer. But it's a great starting point. And in anything that is changed, we'd be able to add in as one-page sort of printable documents as well. So it's just a great place for people to start. And a lot of people find this very useful if a person doesn't necessarily have capacity to make other types of decisions. This can still be used to gather and record information. This document can also be used for by supporters of people who no longer have capacity and they want to record information about that person. It's not legally binding. It's always recommended that these documents be made by the individual, but this one in particular, because it is an illegal document, it can be used to gather information about somebody as well. So if there are a few family members looking after a parent or a sibling or a cousin, whoever it might be, or a few carers looking after a friend, this can start to record information and bring everybody onto the same page. Again, they're not legally binding decisions, but they can provide important information. One of my favorite pages in here, pages 8 and 9 in the Personal Wishes and Care Plan. And if you have that document open in front of you or open on your screen, feel free to go and take a look. It doesn't look exactly like this, but it's just about how a person prefers to be cared for. And this is particularly meant to be used when they can't be describing that in the moment. So if they don't have capacity to tell someone. So it looks after different things like how they physically like to be cared for, maybe spiritually, religiously, or culturally like to be cared for, who they like to spend time with, and what they like to have around them. and a few of their favorite things. And I always joke this is a great place as well to include the things or the people that you don't want in here. So you can have a bit more about a person. Again, this can be really useful for carers, for supporters, looking after somebody, to describe the individual that they're caring about if that person isn't able to do so for themselves anymore. And all of this comes down to this idea of quality of life. So if you are able to take your phone and scan this QR code with your camera. So if you go up here and scan this QR code here, you can type in a word or two, a little phrase of what quality of life means to you, and we can just get a little sample from the room. My fabulous coworker, Lucy, did a little test for us earlier. So quality of life does not really mean testing for her, but it does mean uh, it does mean that we've got something. So I'm not sure if I'm seeing things come up here quite yet. On my other screen, I have a few, so I might see if I can get that to share in just a second there. But some of the words coming in are choice, time with family, peace and content, good health, good family. That's great. And update for me as it comes in, but we've got daily living, warm home, good health, wholesome individual, absence of pain. Some really great things here. And most people will probably have a few of these in there. Some people might say, oh, definitely this, but that doesn't matter so much to me. Everybody's a little bit different with these things. So thanks so much for contributing to that. Oh, so all of this comes to quality of life. You should see this on your screen now. And from one of the recent Tilda studies, it's 2019 now, I was hoping to find something a little bit more recent. There's a number of things that do contribute to quality of life. When we're talking about quality of life, they measure this as control over your sense of your day-to-day and within your surroundings, your sense of autonomy so that other people aren't stopping you from doing the things you want. Self-realization, so are you feeling fulfilled? Are there opportunities in your day-to-day life? And pleasure. Are you getting joy and happiness out of the things you're doing and out of your day-to-day? And these are different factors that influence positively or negatively our quality of life as we get older. Probably our quality of life throughout life, but certainly as we get older. Social networks, who we're connected to, but also how much we participate in those activities. Financial stability, high economic status has a good impact on quality of life. But if there is some planning and things that we can do ahead of time as well to improve that, that'll impact our quality of life as we age. Living arrangements, who we're living with, has more of an impact than where we're living. So I want to point this one out a lot because this is one of the things that I hear the most around kind of in conversation with people would be that they absolutely, wouldn't want to live in a nursing home, for example. This isn't across the board, but it's common enough. Um, the Tilda study shows that what matters more is who you're living with. So people who are living with a spouse tend to find the most quality of life. Again, not across the board, but this is the tendency. But people who are living alone tend to experience a lower quality of life, and rather even than living with other people. And that other people isn't defined in that study, but it does show that living alone can have a poor impact on your quality of life, a negative impact. So it's just something to think about that living with others tends to benefit people in terms of quality of life. So something to think about there. How we can do our tasks of daily living. And if we're impeded in doing those, if we have a hard time doing those things on our own, that can impact our daily living as well. We're talking hygiene, getting dressed, taking walks to the shop, all of those sort of daily living tasks. So when we're supported to do those, we're supported to have a higher quality of life. And then lastly is that idea of perception of health. This doesn't look at our actual health, but how we think about if we're healthy or not healthy. Those who consider themselves to be healthy even if they might have some type of life-limiting condition, or if they feel that their health is good, will have a higher quality of life. Again, it doesn't mean that their health is better or worse than another person's, but that they perceive it to be healthy. So these are things that we can think about when we're thinking about planning for quality of life or having these having these conversations with other people. What does health mean to you? How can we support you to feel healthy? What would be most important to you in terms of your social networks and your participation? What are the most important things for you around your daily living tasks? How often do you like to wash your hair, have your hair done? And your financial stability. What kind of things do you like to buy, and do you like to go out? What do you like to spend money on? Do you have enough money for buying gifts for your family? Whatever it might be. Threw that one in there. So there's a few keys that we would suggest to starting a conversation, and these would be firstly to set a clear time and place. So naming the time and place, Tuesday at 6 o'clock at my house for an hour. Setting a time and place rather than launching this onto somebody. Using clear language. So I'd like to talk to you about what might happen to me in the future if I need support. Or I'm worried that we don't know what you would like if something happens to your health and we don't know what kind of treatment you would want. Can we talk about what kind of treatments would matter the most to you? So using clear language, not using kind of terms like, we don't know what the future might hold, so shouldn't we talk about that? That could mean a lot of different things, but using clear language can help to guide that conversation. And asking for offering specific help. So I might say if I'm asking to talk about my own future, I might say, what I need help with is understanding my treatment options. Can you help me understand or find information about what that might be? Or you can say, what I would like help with is having this conversation with your brother who won't listen to me. Can you help me have that? Or you can say, I'd like to talk to you about your treatment options in the future, but I don't know what they might be. I can do some research and maybe we meet next Tuesday at 6 o'clock to discuss that. So those kinds of really clear language, it might not come at first, but at least you're being open and clear about what it is you'd like to discuss. For those of you who are listening to these conversations, the first step, of course, is just to listen to another person. There's a great habit that we have to say, "Oh, why are you worrying about that? You don't need to worry about that. Don't mind yourself about that at all." But the important thing to do here is just to listen. So listen to the other person's concerns, listen to the other person's um, hopes and what they'd like to get done. Another thing could be if somebody's come to you and you've been dragged here to this webinar, is just to listen to myself here, listen to your friend or your family member about what it is they're thinking about how they might be able to help or find information for you. Just take it in. The second step then would be to clarify, to make sure that you've understood. There can be a lot of miscommunication here, especially when our emotions are running high. So even if I'm upset or uncomfortable, I might say, so I want to just understand that you would like to plan for the future because you might not have capacity. And capacity means you might not be able to make or express your decisions. And so you want to make sure that someone knows now what those would be. That would be, if you can repeat that sentence, you'll be set. So clarifying what it is you think the other person is asking for, making sure that you're getting on the same page. And then from there, you can plan that next step and do that together. Maybe somebody's asked for help. Maybe it's just, we're going to come back in a week's time and have another conversation. That's as easy as a next step. Listen, clarify, and then plan your next steps. Take these things in chunks. There's no need to do this all at once most of the time. We do have some more resources for you at Irish Hospice Foundation. We have Time to Talk, which was launched last summer. You see my windswept hair there. And this is on our website, has different resources for planning ahead. So you might look at a case study and then find resources, for example, for James there, or Eleonora, who wants to document her decisions, people who want to start having the conversation with their aunt or a woman who'd like to have a conversation with her own family, different resources for starting these conversations. And there's also resources there on how to talk to people about grief and how to understand your own grief in different contexts. Lots of facts as well, and signposting to other supports that we have, but all kind of based through our questions and a couple of our great champions there. So Time to Talk is a resource that's available for you. I'll make sure that this link is live in the PDFs and that go out after this as well. And so with that, we're going to move toward some tech support for today. That's a lot of information that we've just given you there on starting conversations, using those worksheets that we gave you last time, on using the plan ahead, on using the My Personal Wishes and Care Plan, and different tips for starting and documenting those conversations. Another type of really essential support is tech support, and this is in particular for enduring power of attorney. I think one of the number one anecdotally questions that we get or would be that it is difficult to get onto their system. We've done a lot of work. We work with the decision support service, and I can guarantee you that it's gotten a lot easier than it was at first. Just a reminder, I think I put this picture in last week as well. Decision support service is made up of some wonderful people who, by calling this helpline, can help you get into the system. So this would be your number one stop to go to. Call them, press 1 for the EPA helpline, and they will help you get into the system and verify your ID. But if you don't want to call them, this is the way you can do it as well. Tech support can be offered to overcome really common obstacles. Tech support is a great way for an informal supporter to help somebody plan ahead, start to plan ahead. So if you're here on this webinar, unless you're sitting next to someone who signed up, you have an email address because you had to have one to sign up for this account. You know how to make an email address. You can help somebody else make an email address. You can help them safely store their email and password. I recommend if somebody has a place where they're writing down phone numbers, names and phone numbers in a little phone book, to include their email address and their password in there as well, so it's easy to find for them. You might be able to help them verify their email address or check their emails regularly if they've given you permission to do that. Sometimes that can be done even through making a decision-making assistance agreement. We're not going to talk about that today, but it's a really non-intrusive, non-technical agreement that you can make that somebody says, yeah, you can help me with any of my tech support needs in case there's any issue. Helping someone log into an account and verify their ID, including, I think this is tricky, uploading documents, uploading and printing documents. So all of these things are the tech support. They're common obstacles, but they're easy to overcome with a bit of support. And as a supporter, formal or informal, much of the time you have this ability to help somebody do these things. If you don't have the ability, I have some signposting for people who do have the ability to do that as well. So with the Decision Support Service, you can create a My DSS account. And with this, all you need is an email address, and then you have to verify it. So if you help somebody get that email address, you can help them get into the Decision Support Service to verify that email address as well. They'll need their first name, their last name, and their date of birth, and they'll make a password. Again, helping somebody remember how to safely store a password can be a very useful tool for somebody. And you can also, they can give you permission to access their account in a decision-making assistance agreement, which doesn't have any technical documents on the DSS that you have to do. So it's much more straightforward. You can also help them verify their ID with My DSS. And I think I have a little video that's going to show you that on the next slide. I do. In order to verify your ID, you don't even need to be in My DSS yet, but you can need your first name and your last name, your address, your phone number, and an email address that you can access. This is the tricky piece for some people is that you need to upload um, on one document a front and back of your photo ID, and you need to upload two proofs of address. So you do need to have a little bit of tech support in order to get that front and back onto one document and to know how to upload two proofs of address. But if you know how to do these things, you can help somebody else. Again, I have more support on who can teach you how to do these things as well, including the decision support service. So if you go here, this will be linked as well, portal.decision-support-service.ie/sign in. You'll see two different options for signing into the decision support service. Most people can do this with MyGov ID. If you have a public services card, you are ready for MyGov ID, even if you don't have one already. You have your name, your address, your public services card, your PPS number, and an email address, and you can make a MyGov ID account. I'm going to link you to the video here as well to help those of you who haven't made one before. Um, but if you have a MyGov ID account, then that links you to all sorts of Irish government sites like revenue or welfare, and you don't have to remember lots of different passwords. So you make one account and you can get in everywhere. The other way that you can log in if you don't have a PPS number, or if you don't have MyGov ID, is to make an account through the Decision Support Service. Both of these are fairly straightforward, and just like it says on the slide previous, all you need for these, went backwards, are an email address, first name, last name, date of birth, and to make a password. So it's really that email address that people need support with, and then just guiding through the website. So there's also some great supports here for My DSS help, including verifying your ID. So if you go to decisionsupportservice.ie/MyDSS help, you'll be brought to this page. There's a portal, there's a fax, there are videos of how to make these, and importantly, we're going to look at this, the identity verification application form. It says it's a form, but you can actually do this online. So you scroll down and it'll show you, do you have all the things that you need? Here's how you get ready to do this. Here's how you complete this application. It's very easy. It'll show you the documents that you need to upload, one photo ID and two proofs of address, and they have to have certain criteria. They'll have that there. The photo ID has to be one of these documents, and the proof of address has to be one of these. You scroll down, click I agree, and you start your application. All the application asks for are your name, address, area code, phone number, email address. Still need that email address. Once you fill that in, you have one more page after that to upload the documents, and then you can submit. This will get your ID verified in just a few days. This is the easiest way to verify your ID if you have some tech support. If you don't have tech support, you can always call that phone number on the decision support service. If you don't have support, they can send you paper documents as well. If you have some support, they'll guide you through this process and they'll guide you through the portal. Next, we have, if my screen will load, I'm not going to play this video, but there are lots of how-to videos from the Decision Support Service, including how to verify your ID using MyGov. But there's lots of videos on how to make the whole process. They're very straightforward and easy to understand, and you'll have all of the links here. But this, with these two slides, and with a bit of tech support, you are allowed to help somebody get into the Decision Support Service and verify their ID. I also want to point out the Age Action has a wonderful series of digital literacy, it's called, support services, where they literally, in this video here, literally shows you how to make an email address, shows you how to navigate the internet. So they have kits that you can take home. They lead workshops all over the country, and they have these videos. They can also, by calling that number, they'll send you a printed pack as well on how to do it. There's lots of support to help people do some of these common obstacles to verifying ID and getting into the system. Some libraries as well will have tech support days, where they might be able to help with some of the basics, and they might even be able to help you upload a document. And so that'll vary place by place, but they'll certainly be able to print documents for you and oftentimes upload. They won't be able to log into your accounts for you, of course, but they can help you with some of those other steps as well. So there are lots of supports out there. And even if this isn't your or the person that you're supporting their normal area of comfort, most people can learn this or be supported in doing these tasks. So with this, I just want to introduce you to your homework for the next month, actually. So you have a few weeks here before we meet again. And in the meanwhile, you're invited to review some of these documents that have been shared with you today. So I would invite you to go back and review the personal wishes and care plan that was shared with you last week and is in that webinar 1 folder. And these are also here in the webinar 1 folder. So the first is a quality of life worksheet. It's very basic, just to start getting a sense of what matters to you. And worksheet 4 are barriers to planning ahead. So just, I'm going to pause this so it doesn't skip ahead. And these are simple statements that you can say, am I very likely or very unlikely to say this statement? The first one might be, thinking about planning ahead, I don't want to upset my family. If I'm very likely, I'll circle 3. And if I'm very unlikely, I love upsetting my family, I'll circle 0. Everybody will be a little bit different. And there's 18 of these questions. You'll see they're each colored a different color. So it'll scroll down here for me in just a second, and you'll be able to see that at the end of this, you can tally up by color your different scores. So all of those in kind of a light pink, beigey color are social barriers. All of those in that darker green are emotional barriers, and some of them are motivation or skills. So you can see when working with somebody or for yourself, these are more of the barriers that I have. When we know what those barriers are, then we know where a person might need more support in doing some of the activities. So between looking at quality of life, thinking about what that means to you, and looking at these barriers, you'll have a sense of where a person might want to go next. Once again, just going to share this contact for the decision support service. Call them, press 1 for the EPA helpline. I wish I'd meant to put up in here and I forgot, but they are having road shows around the country where they're popping up and actually helping people get into the system and make their enduring power of attorney. And you'll get sent away with the documents ready to be signed. We'll talk about those next week. So there's lots that they're doing out in the community to help you as well. As a reminder, we have our own information and support line. This is non-clinical support, but can offer guidance on end-of-life care, advanced care planning, and palliative care. We have the free phone there, 1-800 or 1800 60 70 66. And you can also email the information and support line at support@hospicefoundation.ie, which is up here in this top. Think Ahead can be downloaded, the QR code on the left. That's for free. You already have it in the folders, in the emails that I've sent you. You can order hard copies over the phone by dialing that number, or you can order online by the QR code on the right if you want to order online or order in bulk. And for many HSE departments, not all, but for many, and for all nursing homes, we do have a discounted rate. Now, we've been able to bring those prices down this year for everybody, but we have even a slightly lower rate for the HSE.